Look at this. Probably these team were experts in placement of implants, for sure. But first of all, they were thinking of placing an implant cylindrical here. And this is the picture that I took out from the publication. Look at that. That did the austerity. What are you seeing here? A lot of bone debris. This is actually what happened when you're drilling. And this is with the use of an erbium laser. Look at the difference. Here, and I'm sure that a lot of you are doing endodontics as well. What happens in endodontics if you're using a rotary instrument? You're closing the tubules, right? And if it happens to you to use an erbium laser, what happens? You open these tubules. You clean your canals, all the openings. For those that are expert in endodontics, you probably have heard about these Anthogyrs. What are these Anthogyrs? The germs that are stuck inside the tubules. Some of them more than 1 millimeter, more than 1,000 microns. But if you're using a rotary instrument, you close the possibility. And this is why we call them Anthogyrs. This means that it happens exactly the same thing. Because of its own structure in the bone, in the cancellous bone. That means that if you're using some devices, like rotary instruments, or kidso surgery, you will leave all the time bone debris. So, to make short, they end up by this conclusion. Nevertheless, that they were not experts in the use of laser. Because if they knew about the use of laser, of an erbium laser, they will have known that if you're using an erbium laser, then the action is divergent. That means the vaporization will have a divergent shape. And this is what happened. So, you know, this was published in a peer-to-peer review. But of course, these people didn't know about the use of laser. So how can you publish and make a comparison between devices that you don't know? Nevertheless, they end up by the same ISQ, implant stability quotient, which is actually the traduction of the primary stability. Well, to come back to this bone expansion. Bone expansion, Summers was the first one that promoted the use of conical osteotomes. Why that? Because in '94, well, hundreds of years ago, but in '94, he proposed the use of conical because he wanted to expand the bone. He wanted to spread it, not only vertically, but laterally. And again, there's a lot of publication, and I'll just give you here the conclusion of one of these last publications, and summarizing exactly what is the Summers technique. It shifts actually the density of your bone because you expanded it. So it's not a new technique, bone expansion. But if you expand these trabecular bone, then for sure you will end up by increasing these BIC. And very often what happens is that you're accelerating the bone healing. Anyway, they all end up by rising of the primary stability, gaining in bone density, and in bone implant contact. What about this and the sizing? Because everything is linked. if you want to gain in bone expansion, then you probably need to undersize your bed preparation. And I will end up with this, right? So different publications, again, have shown that we can undersize the bone bed preparation with actually good issues. But if you undersize your bone preparation, that means that, remember the example of this screw in the bone, in the wood, you will have to apply a high torque. And again, there's a lot of publication showing that up to 176 Newton centimeter. 176. Again, because I've been criticized in saying, yeah, you said that we need to place or apply 176. No, no. Not at all. This has been published. And this means that we can apply a high torque rate. Doesn't mean that all your implants you have to place 176, otherwise all your patients will come out to your practice like this because of the force you apply. But it's possible. And personally, I give you my personal experience. Most of the cases, I'm applying more than 110. Because the motor, the device I'm using, Anthogyr, is stopping at 80. So at 80, I know that because the motor is stopping. And then I'm using the hand wrench, and I'm using more or less 100, 110. Shall we stop, or? Yep, okay.
I thank you, gentlemen, for your patience. Dr. Uthman Wali, who is Dean of the Dental College of Ibn Sina, will be presenting the technical specifications of the Anthogyr implant system. So, and thereafter we'll have discussion and questions from your side, whether to Dr. Jill Chomonet or to the implant system directed to Dr. Uthman Wali.
Second part is coming all the clinical issues, all the clinical
Yeah, we'll see.
cases.